Hi, everybody. Christine is back. Just here with another interview on, something that is going to create some inspiration, um, something that you can take into your life. So we'll look at some steps that you can take this information into your life. We're all about like holistic health, spiritual health, well-being, ascension, and you know everything that I do is really in alignment for the highest good of all. So my intention is that you guys are able to get something really great from this interview and maybe want to share it. If you want to share it with somebody that you love, that would be amazing. Just whatever comes through in this information, know that we work at multidimensional levels, and everything I do is at a multidimensional level. And because I do that, and because that's so important to me, that means that you'll tend to have activations, realizations, downloads far into the future beyond this one interview. So definitely let me know how you enjoyed the content today at the end of this, and if you have any questions for any of us, that's I'm happy to connect, bring that information into the realm of discussion, and then also to forward you guys any information that you might need. Okay, so thanks so much for everything, for joining us. So this is Erica Rodas, and she is a holistic pelvic care practitioner. I'm just reading her bio, full transparency. And so she's a holistic pelvic care practitioner and writer who helps women feel at home in their bodies after a diagnosis, life transition, emotional difficulty, or with chronic pain. Over the years, she has come to understand her body as a place to connect and reset, and finds modalities such as self-massage, breath, and visualization to be powerful tools towards that aim. Erica fosters connection and creativity through one-on-one sessions, workshops, and conversation. And we have her where you can reach her Instagram, and her website as well. So that will be put in the comments. So it's just at ericarodas.com and at Erica Rodas underscore on Instagram. But don't worry, it will be in the comments or in the description. So you can find that information there if she resonates with you. And so today, I think we're going to definitely be talking about women and women's bodies, more in particular. And if you fall under that category, great. If you don't, send this to somebody who could use it. I'm sure you have a woman in your life who is dealing with different things, feminine issues, menstrual issues, cycle issues, and body image issues. So we're going to definitely touch on some of those topics. We're also going to touch on like touch, healing ourselves, honoring our cycles and our energies and stuff like that. And then, how we can dialogue with our bodies, which I think is really important. So much of the stuff around feminine issues is just like, okay, go to the doctor and have them solve it for you, rather than actually, actually find a way to work through it or to be your own healer in a sense. So I just hope that is supportive for you guys in this sense, in this work. So Erica, where do you want to start? What got you into this work,
Yeah, thank you so much for having me. I loved what you said too, just about however it lands for people listening, and whether it kind of brings like a revelation or something to the surface, because I think that's part of what brings me to this work, is really learning to listen to ourselves. And I think so often when people encounter, again, whether it's a diagnosis or a transition in their life or just a difficult thing, it's so human and understandable that we sort of look outside of us for direction. And I think that is, sometimes that support can be helpful, but I think bringing it back to what you're saying about really, we're also capable of caring for ourselves and tuning inward for some of that direction. So in terms of how I got brought to this work, I guess have been sort of, my body's had some kind of physical sensation going on for the last 15 years. It started out in my lower back and something I felt that I could manage. And then showed up in my shoulder at one point, and then most recently showed up in my pelvis. And it wasn't until recently where, in the beginning with my lower back pain and stuff like that, I learned all these things to do to kind of manage my pain. So I learned, what footwear helped. I learned about anatomy, and I learned sort of some of the physical challenges that I was, hypermobile and things like that. But I always felt like I had to kind of control my body to be one step ahead of the pain. And it wasn't until in this last year and a half or so that I realized that my body wasn't looking to be managed or controlled, but just to be listened to. Because when it came to my pelvic pain, I wasn't able to just run through the list of to-do things, but had to really kind of drop in and look at some of the emotional work and some of the energetics of what was going on. And then that resonated with what I was seeing with, at the time I was practicing as an occupational therapist solely, and I was seeing a lot of the same things with my clients too. So that overlap made me want to take a look further.
Wow, no, that's amazing. And it can take a long time for us to get to the point where we're like, oh my goodness, like I could potentially heal myself. Like what is that? And I know for my own journey that, with endometriosis, that definitely was a sort of a jumping off point of like, okay, is it possible that maybe there's something else at play here? Maybe I love what you said about trying to control your body and trying to like manage it like it's like an employee of yours or something like that. Right? We know how well that works for, I mean, it really doesn't. Then you have all of these it's praise and punishment paradigms and stuff like that come out of that. And I don't actually feel that that's very useful in long term, because it's like, I think especially as the rising of this new energy, as we go through the ascension and all of that stuff, and it's not even so much about oh, there's more energy on the planet or there's more light on the planet. There's more awareness, and as we kind of emerge into that awareness and deeper awareness, deeper understanding, it's like we can look back at ourselves and our lives from a completely different perspective and like, oh my goodness, like this was really what was happening and I didn't know, and I thought it was this thing, but it's actually this thing. But hey, maybe it's like more than just those things. Maybe it's like 20 times those things, like who knows, right? So that's amazing, like that you were able to like come into that. But I understand it could, it took some time for that to happen because that's not what we're taught, know?
Yeah, no. And I think even I'm still always learning and kind of growing into it. I think that it's really almost automatic to go to the checklist or to try and like manage. And so it takes, I think, sort of like an intentional pause to just create time in your day to spend time with your body. And again, even if that's, sometimes people are like, I don't have time for anything else, but it's just like 5 minutes even. I think of it as like a relationship that if you never spent time with your friend, that relationship would suffer. And so it's really worth carving out a little bit of time.
I love that. And I love that you're bringing it back to the relationship, because I think everything is a relationship in life. I had an interview a couple of weeks ago on money and how money is a relationship. We have a relationship with our money and our money mindset and all of that. And then relating that topic to our bodies and to how we eat and to how we communicate with other people. Like it's all connected, like it's all intermingled. It's not just one thing. And I'm really seeing that more and more. And that's amazing. So that's like kudos to you for like really going down that journey and really looking at yourself. So how did you bring this work into your clients, and like what are you kind of hoping to do more as you move forward with clients, having gone through this journey yourself and seeing and understanding things on a whole new level? Where do you feel like you want to go with that?
Yeah, so just as a bit of context, the last chunk of my time has been in a one-to-one private practice setting with women, mostly in post breast cancer and GYN cancer and head and neck cancer rehab. And so what was happening in, again, those situations, or those encounters rather, was that we were sort of addressing a lot of the physical issues in manual therapy. And I sort of saw my role then as providing people a place to land. But there was still a little bit of this quality of they're coming to me to be fixed. And
Mm,
then when COVID happened, and I was sort of forced to um, engage with people virtually and wasn't able to use my hands, it really was incredible to see, to lead people through touching themselves and using some of the breath and
mm,
the visualization, um, and the shift that that offered them, that they're not, again, just kind of like laying on the table to be fixed, but really having to engage with their own body. And so I have just recently shifted in starting my own business and also seeing people just virtually, because I think that um, guiding people to, again, touch themselves and kind of learn some of these practices, which then they can take on their own, is just something I feel so passionate about, because there's just so much there. And I love that you just drew the connection between like money and eating and our bodies, because I think too that in my experience, when we can be with our bodies, it is like this portal into all these other areas. And so we see ourselves maybe then showing up in our relationships differently, or showing up in our relationship to food, or in our relationship to money. And so it really is just like this sort of launching pad into all of these other areas, which is, people come to me often for pain,
mm.
but there's so, like, pain is almost just, that we've said, like the invitation to all the stuff that's underneath it. And um, I think that's where too I I think oncology will always have a space in my heart, but I'm also excited to work with really anyone going through any transition, because I think almost any transition you can think of is going to have an element that's very well, maybe not always, but that is sort of like possibility and exciting, and then one that's loss and sort of grief around that. Something even as happy as having a baby, that's going to have both sides of that coin, and then even something as
Mm.
the end of a relationship or the end of a job, could potentially have those too. So helping people see that both of those can sit at the same table, so to speak, is something that I get excited about helping with.
That's amazing that actually you touched on grief. So you're probably psychic as well, a little bit psychic. So I just recently did a interview on grief, and we were literally talking about grief. It was a dialogue between me and somebody else who hosted me, and it was such a big subject because I kept getting intuitive downloads in the last couple of weeks of like, humanity is going to be going through a lot of grief. Now, I had that before, back last year, and around November, there was a lot of that coming up, but it was all hidden by anger. And the same time with this one, that's what my guides would bring to me, or my higher self brings to me, is like, here's something that you're going to get triggered by, but this is actually a message for the collective. Because as I go in and I look at it, I'm like, okay, what's going on here? So I think it's really important that you touch on grief, because I think, we're all going through some form of grieving,
Yeah.
in some way, shape, or form, whether personally, like indirectly or indirectly. I think we're all going through something like that. And it's actually brilliant that what you're doing right now is literally helping people through these processes, because grief and grieving is not something we can avoid. It's a process that is part of life.
Yeah.
Because I think a lot of what we get attached to in life is sort of attachment and ego and all of that stuff. And there's nothing bad about that inherently, because it keeps us solid and anchored in the world, in the physical world. But then when we look at it from the spiritual perspective or an energetic perspective, it's like, oh, like this is, this is something that we learn to work with, rather than dismiss or ignore or pretend it's not there. And so I think it's amazing that you're like really addressing this, because I think people who are suffering in the state of illness, right, they're going through their own grief of like, I lost what I used to have. And my feeling is there's always a gift in every perceived loss, right?
Yeah,
Because you
absolutely.
and you come into this life with nothing and you leave with nothing, and it's like there was nothing to ever really gain except for maybe knowledge, experience, and personal growth within your own soul's expansion, I think. That's just my belief, but I'm sure other people have a different perspective on that, which is totally valid. But yeah, I mean, how are you finding with your clients currently in sort of, is grief sort of a big thing coming up in the context of your work at this point?
Yeah, so I think I love everything that you just touched upon, by the way. So thank you for articulating all of that. I think one of the things, and again, a lot of my experience is in the oncology world. So what I can say is that, people will go through, let's say, cancer treatment or even substitute any sort of major push. And I almost think that this whole year that we've last had as a collective has been sort of like this acute push of like not knowing yet if we're totally going to be okay. I think people and what I'm sensing now is that we're kind of starting to see that we're going to be okay, though there's a lot, I think, of work, like you're saying, grief work that's going to need to be done. But you go through this push and then you come at the end and you haven't had time to process any of the grief because you have been on survival mode, rightly so, right?
Yep.
And so a lot of times people just have this sense of like, what just happened, or why don't I feel like myself, or they feel anything from like they don't feel like themselves to they don't feel sexual towards their partner or comfortable in their own bodies. And I think a lot of times our communities can not offer as much time to really grieve as we might need. So I know a lot of things that I've heard sometimes from clients is that when they're going through treatment, or again, that acute phase, like let's say if someone in their life has passed or something like that as well, that people show up right at that moment. And that's a beautiful thing. But then sort of in the months or even years after, when they're still kind of sorting through that, that, people aren't as able to sit with them kind of through those more, people might say like chronic times. Because I think it's uncomfortable for someone to sit with you when they don't feel like they can fix it. As humans, we want to help each other and fix. And when there's no obvious fix, it's sort of, you don't know what to do. I think, again, this is where some of the self-massage work, and the woman that I had trained with, Tammy Lynn Kent, talks about how our pelvic bowl holds so much grief. And so doing some of the self-massage, in and around vaginally. And then even if that feels a little bit aggressive, then coming around our breast space and thinking even about how much our chests hold in terms of our lung space and grief and all of that. So I think sometimes I will guide people, or even in my own practice, to use touch to move some of that energy through. And because again, emotion, grief is beautiful on the one hand, because it's almost showing you that you've loved. I know that was said to me once, and I loved that. And just like any emotion, it can pass its way through, but it's just that it can get stuck if we are, like you're saying, sort of shoving it away or not really addressing it or meeting it.
Yeah, I mean, and it's really important that we're talking about this. I think this is a subject that like not a lot of people know how to like you said, they don't know how to address it. They don't know how to talk to people about it, because we're in, for a lot of us, we were brought up in a culture and, a society, which was like, get over it. Like, and I gave this example the other day, and it was like, oh, you've got cramps, take a pill and get on with it. There's nothing in, like, at least my growing up, and I don't blame anybody for it, because we just do what we're taught, and that's just the way we manage, right? And it's not about blame or shame or guilt. It's about coming back in and like figuring out, okay, well, what do I need for me to move forward? Is what society has been offering me a viable option anymore? Or is this something that I can let go of and no longer incorporate into my life? Or maybe it's a bit of both. Maybe I can have some of this and some of that. Or maybe it's something else completely different that I haven't even thought of. So I think that there's not one way for us to address this and look at this stuff. And, especially with the connection with our bodies has been so degraded. We're, taught to pop a pill. We're taught to like, just not deal with stuff, not deal with emotions and all of that. And I think we're coming into a deeper awareness now of actually dealing with it. So I think that's amazing. And we're going in the right direction as far as that's concerned, for sure.
Yeah.
But I think also people are flailing because they're not really sure. This is like, oh, this is a new thing. I don't really know anything about it, and am I doing it right? And I would say, I don't think there's any wrong way to do it. I think, if you're connecting to your intuitive guidance, your inner compass around these topics, I think that that's the best way to do it. And nothing outside of you can really tell you what's best for you and your relationship with your body.
Yeah.
No,
you touch upon so many things. I think the first thing that came up when you were talking about like the take a pill thing, I mean, I think a lot of it too is that like our society is moving at such a fast, especially pre-COVID, like a fast clip that our bodies just can't really keep up. And you say, well, no, then I do these, I take a pill or whatever it is, but you're then kind of just, hobbling along, but your body is suffering for in some way, So I
yep.
think there's sort of the factor of humility when you look at actually letting the body's pace guide your activity. And that can be, for women according to your cycle, but even just generally like seeing the balance in between how much I'm doing and how much I'm resting and really honoring that. And I think that we sort of get points for working so hard and like wearing that as a badge of honor. And we're not really rewarded as much for resting and things like that. So again, it's understandable giving ourselves some self-compassion that why we might be doing these things and where they're coming from. And then you said something else, but I'm not remembering now. It's towards the end, but yeah, I think you're spot on with a lot of things that you said.
And you too. I love what you're bringing to this conversation because you have sort of the knowledge and the ground. What is it? The hands-on, ear to the ground, like grassroots level kind of stuff where you've gone through a certain type of medical training in some capacity, right? And so you kind of understand what the education behind all of this is, and you understand what the patients are coming to you with. And then, I from what I've heard, not from you, but from others, have said, like sometimes they find themselves feeling frustrated that their training isn't actually solving the client's problems. They're just treating it, and there's no real solution that's long-term and like, okay, it's done, right? Like, and I think that's why people get frustrated with the healing journey, because it's a journey and it's like, okay, can I just like live my life, or do I have to be on a healing journey my whole life? Like, like where do I win here? Like, do I have to keep doing this? And my understanding has been to like, well, you can live your life and continue to work on yourself, but maybe not call it work on yourself. Maybe call it taking care of yourself. Work has such a loaded word. I know you mentioned about doing and resting and those two things. And it's like, what if doing wasn't equated to success, productivity, and being good enough? What if doing was just you being in your own natural, passionate energy of creation mode, and resting was just you taking a break from, the creation? Like maybe that's your, what do they call it? Like the ebb and flow, or the expansion contraction energy that's naturally occurring all the time in the universe and within us as well.
Yeah. I'm like, yes. No, but I think again, spot on with a lot of things there. For one, I think that attitude of like work, there's even, I remember one time I was listening to this podcast and this mother of mindfulness, Ellen Langer, was talking about how they did a study and they showed that like when they called something play versus they called something work, that they then like looked at, I forget what hormone exactly, but that the people who called this portion of their activity, play, had a less stress induced sort of hormones running through their body versus people who called it work. And so I think that even when we approach our healing, in my experience in the medical system, it's often from this workplace, right? It's like, I'm going to do these things. I'm going to do these exercises. I'm going to eat this way. I'm going to get this amount of sleep, like whatever it is. But it's this very like, okay, like I'm going to do it. And yet that doesn't really, like you're saying, like that's not really how it works. And what happens when we can approach it from this more exploratory place. And I remembered what you had said and previously too, is that this idea of almost letting things be messy. And so that it doesn't mean that like every encounter we have with our body, we're going to totally understand her and, everything's going to be neat and just linear and all that. Like it's a lot more messy than that. But the reality is it's a lot more messy than that. So I think sometimes if we can just accept that, and I think that's where the frustration comes in. I think sometimes when, well, there's a lot of reasons, but I think one of it is that like if they're not, feeling this progress, but the truth is it's not going to be this like, straight line. And that if you can understand that that's just the name of the game, the way that this works, like you're not doing anything wrong. This is just kind of all part of it. I think it makes you feel less like you're failing. Because I remember even one time I'm someone who works with this stuff, reads about, thinks about this stuff, but I was at one point feeling very frustrated with what I saw was my lack of progress in my pelvic pain. And this was probably like 5 or 6 months into it. And I said to my friend, I was like, I'm doing all the things, like I don't understand. And he was just kind of like, what would you tell someone that you're working with in this situation? And I was like, right, like it's not about doing all the things. So I share that to mean that it is, again, a practice to start addressing your body this way, at least in my experience for me, just because there is like a certain amount of programming I think we have that things have to be neat and fixed and like, and also the one which, perfect, or that like, if it isn't fixed yet, well, then this is how this is going to be forever. And that's just not the truth. I mean, we're just so much more dynamic than that.
Extreme, like one to the other. It's all this or it's all that. It's black or it's white. It's dark or it's light. It's just like, no, that's not really how reality is. It's way more gray.
Yeah. And again, not to continue to quote her, but Tammy Lynn Kent, the founder of the Holistic Pelvic Care material, she always says that when you catch your brain doing that, it's sort of what she calls a 2-dimensional thinking. And that's a good thing for you to note, that your brain is kind of in that survival mode. Because when you are in a more grounded place and when you aren't quite as activated, you recognize that there are so many possibilities. And so I've done that myself, even in the last week, where I'll encounter a situation, I'll see that my brain is thinking about it in terms of, well, it's this or it's that. And then I'm like, okay, so that's a good sign that this isn't a time for me to make a decision, actually, that I need to do some grounding or some resting or some body work. So it's kind of like it's almost like my engine light is on when I catch myself in that thinking.
Well, and it's being more compassionate, which frankly is not easy for us, I think. We look at the way all of the systems and structures in our society are set up, and it's not set up in a compassionate way at all. It's shame, blame, and guilt for the most part. I would say that there's maybe some deviations here and there, but for the most part, it's shame, blame, and guilt. And if the rest of our society is like that, then of course we're going to be programmed to be like that towards ourselves. But if we start looking at ourselves, and I'm like, okay, for me anyways, it's like, how can I be more compassionate? So for me, if I'm on my cycle or whatever, I'm going to be like, okay, well, I'm not going to like try and push myself or force myself to do this or that, either the other thing that I think I should do in order to be successful and productive. It's like, I will create, like for me, it's like, I'm going to create my life around my self-care, around taking care of me, because if I fall apart, then I can't do anything for anyone else anyways. So how does that help? And I think we were talking about when last time we were chatting, not live like this, but like, privately, we're talking about mothers and how mothers are so hard on themselves, and how that would be a great opportunity to bring in more compassion, right? And isn't it, I can't remember her name right now. Brené Brown said something about the solution to shame is compassion.
Yeah.
And that's not easy because that takes patience, that takes nurturing the inner child, that takes nurturing the body in a way that we are not taught. So it's like, okay, this is a brave new world of figuring this all out. But like you said, like it can be messy and it's okay for it to be messy, so
Yeah.
I love that.
No, totally. It's funny, as you were talking before, you said, I was thinking like the mother, that's so funny that we're connected on that way. Because I think that what came to mind was that whether it's being a mother, whether it's being a partner, whether it's being, in my situation, like a healthcare practitioner, there seems to be this message that you have to be about the other person, whether that's your child, your partner, or your patient or client. And that you have to be fully in service to them. And where I do appreciate where that sentiment comes from, the reality is that's just not going to be sustainable. And we talk about that in terms of like putting your own oxygen mask on, but like truly that when you are depleted, you're just not going to have anything to give. And I think that when we talk about this idea of like compassion, I think I used to sort of, and sometimes still do, struggle with this idea of like, how do I love myself? Like that just seems like this really big thing. And I think a way that I've kind of mentioned with clients and also in my own practice is like, even just noticing something. So noticing, oh wow, like I am having a hard time with resting right now, or I just said this to myself that wasn't like the most kind thing. That in and of itself is like a loving act. And if you think about, again, like relationship with another person, that when you feel noticed and you feel someone's attention on you, even if it's like something physical, like, oh, I really like your hair, or even if it's something like, I noticed that really excited you, or whatever it is, just having that said aloud to you makes you feel so loved. And so I guess what I mean to say is that I think with people who might find the ideas of compassion or self-love, maybe if they feel this, what I used to, these sort of big idea concepts, and I'm like, how do I even access that? I think starting to, again, notice yourself can be a really easy inroad to that.
That's great. Actually, that makes everything so much more tangible. And I love when we can bring tangible things to these concepts, because it's just so much easier to say, like, it's easy to say like, oh, love yourself. It's another thing to say like, okay, well, how do I do that? Like, what does that look like? And I also feel like, and I've said this to a previous client too, who had said, oh, well, I do my nails and I get my hair done and I get a massage, a couple times a month. And it's like, is that self-love for you? Or is that just what people prescribe as self-love? And like, what does that look like for men? Like, obviously, maybe a man isn't necessarily going to go get his hair colored, or he might, I don't know. But like, it might not look the same for, depending on where you identify gender wise and all of that stuff too, right? So there's just different layers and levels of what self-care even looks like. So one of the things my client said, I said, well, what thing are you avoiding doing that is good for you, but you've been avoiding it? Oh, going to the dentist. I haven't booked my dentist appointment. And then when she went to her dentist appointment, she's like, oh my God, I feel so much better. That's no longer that thing in the back of my head bugging me. So I think maybe sometimes it's even just addressing the things that you're avoiding, and maybe even considering why you're avoiding them. Well, why am I avoiding this? Like, what do I need to, like, what could I look at here? Not need to, but what could I look at here that would help me to connect with this thing so that it's easier for me to do rather than me forcing it, and I find that that's what, we're encouraged to do, is to force ourselves to do this and that, the other thing. And it's like, why does it need to be that way? It doesn't, right?
Yeah. No, and it's funny, like when you talk that way, it makes me think of even in some of the body work that I used to do, and now lead people through, it is very subtle in how you kind of settle into it. And it's sometimes counter to what people are familiar with, which is like this, like getting in there massage and like, let me get this knot out, or like, let me foam roll the bejesus out of my IT band or whatever it is.
Oh, your poor body.
And again, I used to, like 10 years ago, I definitely foam rolled a lot out, or tried to. And there's parts of me sometimes that catches myself still trying to bulldoze into things. But I guess if you think about when we kind of bulldoze into anything, our bodies may act protectively and kind of grip up, and then it's sort of counter to what we're trying to get to happen. And so I think the same can be said. Again, our bodies mirror our lives. So if you're sort of forcing yourself into something that you're not either totally ready for, or is not really about you, but is about the way someone else is looking at you, it's worth asking the question, is there another way that I can access this at like a little bit of a smaller stage, and sort of in doing that, start to trust that I can do, brave things, or whatever this thing that you're trying to get into. And then let that be feeding then to the next thing, in the same way that, like, if you're touching yourself, that you want to sort of gently bring your hand into the tissue so that it slowly starts to open up, as opposed to you just like weaseling your way into it. And I think it's fascinating, like what you said about the self-care is, I almost sometimes wince internally at that phrase, because I think it's come to mean almost like a marketing tool for like all the products that you need, or like all these things. And
the buzzword for sure.
Yeah. And that like people, you can go through self-care, and again, I've done this, so it's not a judgmental thing, but like, and not be even with yourself at all. Like you're
disconnected.
Yeah. And I think, it's funny, even like, I think about that. I used to do lots and lots of yoga, and there was a positive in doing that, but so often I was, just my mind was not there. And it was thinking about what I needed to do that day, or what I wanted to have for dinner, or like all those things. So being honest with yourself, if you can do activities that you can actually be with yourself during.
Yeah. And I mean, I love the inner child work because I find that that's the easiest way to approach it. Like if I were talking to a little kid, that was my body or whatever, then, and I wanted to be kind and compassionate, like what would I do? And what, sometimes, like you said, it's not just about you deciding what's best for that part of you and then forcing your way into it. It's having an open dialogue with the body. Like we when we were talking about pain before, about how pain is sort of a signal. It's like hey, stop doing this thing that you're doing, stop doing it, please stop, and it's almost like, but it had to get to that point where you were ignoring all the red flags and stuff like that, to fully get to that point. So it's really building the relationship, like you said, relationship with your body is a two-way street. It's not you just dictating how it's going to be. It's having an open dialogue and conversation, and then trying to get on the same page. Because that's how when I do the inner child work, that's the same thing. It's like you getting on the same page with your inner child, and having a dialogue so that you guys can like no longer be in conflict with each other. Because if you're in conflict with your body, you just perpetuate, like you said, your inner world reflects the outer world too, and the perpetuating that conflict within is going to perpetuate conflict without in many ways in your life.
Interesting.
I think so. Anyways, I mean, I think that's how it works from what I've studied.
That makes total sense. I more just say that in the sense of I appreciate you articulating that, because I'm learning from you.
Oh, likewise. This is great. I'm so honored that we get to do this. Yeah. I mean, is there anything else that you feel like we can tap into, or any sort of last messages that you feel like people should, you would love people to know?
Yeah. I mean, I think just that question of if someone's like, how do I even get started? I think that an easy sort of starting point is placing your hand somewhere on your body every day for 3 to 5 minutes, whether when you wake up in the morning, or before you go to bed, or in between. During work hours, it might be a little challenging, but try. and just kind of breathing into that part and seeing what comes up for you, whether that is, it's really hard to be here right now. This feels really grounding right now. I hate this right now, like whatever it is, and just kind of getting a little bit of a sense of how your body is, like, what is your relationship right now? Um, and I know that like the chest area or the side of the neck area, we even do that instinctively sometimes if you're having a difficult conversation and you're like kind of doing this, it's like that
Mhm.
self-soothing. So that can be a really nice area just to sort of ground, and again just meet that with your attention and your breath. And yeah, I mean, I'm certainly here as a resource if anyone has questions too
Yes,
on obviously more
please.
specific guidance or any of that. I'm all ears.
No, I love this and it's amazing. I'm so glad we could have this conversation. I know we touched on most of the stuff that we mentioned that we wanted to talk about. So yeah, I mean, if any, if there are other healthcare professionals and practitioners who approach things from a holistic perspective, like come on the show and let's have a conversation. I just love doing this. And Erica was so generous with her time today and her
Thank you.
energy and just her knowledge. It just, take what resonates and if something doesn't resonate with you, it might not be for you right now, it could be for you later, it could be for somebody else. That's all okay. We don't need to fixate on what we don't agree with. We can focus on what resonates and then move with that energy, because that's expansive energy. And I think it's so important that we focus there more so than anywhere else. Where can we expand? Where can we create? Where can we come into a greater measure and a wholeness of ourselves and others and everything that is this life, if
Yeah.
that makes sense.
No, I think I appreciate, that's a great way to look at it.
Yeah. So if anybody wants to connect with Erica, and you want to develop a deeper connection with your body and you would like support around that, and even just talk about this stuff,
Yeah.
I mean, how many people do you have in your life that you can reasonably or conceivably even talk to about this kind of stuff? I think just even having a compassionate ear, or just a connection with somebody who is saying something that maybe you're like, oh wow, I've always wondered about that, or oh, I don't really know anybody who's talking about that. Like, let me reach out and connect and see if there's a way that we could have a dialogue or we could work together or what have you. So yeah, just take that into account. Anybody who's watching, thank you so much for watching. Thank you, Erica, for being here. I
Well,
just
thank you for
really
having
love
me. I'm
talking to you. You're such a lovely person. And I can't wait to do this again. If you ever wanted to do this again, I would love to have you. Um, and you can find all of my details. I do psychic healing, intuitive, multidimensional healing work as well. It's my own stuff. And so you can check out my stuff. You can check out Erica's stuff. It's all going to be in the description. So yeah, and comment, let me know what your thoughts are, share the video if it feels resonant to you, share with a friend. Definitely hit the like button if you liked the video. And I'm just so grateful. Thank you so much again. Have a beautiful week, and I'll talk to you all soon.